A man in his 30s is among 12 people who have passed away from coronavirus in Victoria in the past 24 hours. There are 466 new cases as the state's chief health officer revealed an extra 20,000 cases have been avoided by new restrictions.
2 men in their 70s, 2 men and 3 women in their 80s and 4 women in their 90s are the latest COVID victims. Half the deaths recorded in Victoria are linked to aged care facilities, but one was a man in his 30s.
He was not a health worker, I can confirm that. Beyond that, though, I'm not in a position to be able to confirm anything.
This is not a disease which impacts only on elderly people. Every Australian is vulnerable. Every Australian needs to protect their health, including young Australians. Of course, there's a great danger that young Australians, even if they don't get sick, will spread the virus if they're not careful to older Australians. But there's also a danger for themselves.
There were 466 new cases on Saturday, compared with 450 on Friday. Victoria's Chief Health Officer Brett Sutton says the numbers would have been worse if the state hadn't gone into lockdown.
If we hadn't stabilised these numbers, we would have seen thousands of cases per day, and there are estimates we've averted 20,000 or more cases by virtue of the stage 3 restrictions.
The Premier says they're exercising an abundance of caution.
With the number of mystery cases that we have across the state, and indeed some in regional Victoria, we have to assume that there is more virus, more transmission, more cases out there than the data tells us.
A report from the College of Nursing suggests the state is facing a dangerous PPE shortage. 1 in 5 nurses don't have access to appropriate protective equipment. The Premier defended the government's supply.
We have in our PPE warehouse at the moment, we have 68 million gloves, 19 million surgical masks, 2 million face shields and 530,000 goggles.
Charlotte Mortlock, Sky News.